Now let's talk about heme synthesis, porphyrias, and lead poisoning. The porphyrias are hereditary or acquired conditions of defective heme synthesis that led to the accumulation of heme precursors. Lead inhibits specific enzymes needed in heme synthesis, leading to similar condition. So we have, what are the conditions? We have lead poisoning, we have acute intermittent porphyria, we have Porphyria, Cutanea, Tarda, right? Just looking at how the biochemistry works is that we have, starting from here, we have succinyl-CoA and glycine. There's a rate limiting enzyme, ALA synthase, works on it and converts that into amino levulinic acid. And still we are in mitochondria. That amino levulinic acid goes from mitochondria to cytosol by the enzyme known as ALA dehydratase. And when it comes to cytoplasm, now it's called porphobilinogen. That porphobilinogen becomes hydroxymethylbilane by the help of enzyme porphobilinogen deaminase. That hydroxymethylbilane forms uroporphyrinogen 3, and that forms the coproporphyrinogen 3. From uroporphyrinogen to coproporphyrinogen 3 by the help of enzyme called uroporphyrinogen decarboxylase. So this is a sort of a memorizing thing. We got to memorize this thing, and the diseases, it's going to be easy and simple to understand then. So that this one now has to go back to the mitochondria, and here it forms the protoporphyrin, which becomes, and when the iron is added to it, it becomes heme within the mitochondria. So the structure it goes is from mitochondria outside cytosol and then back to the mitochondria. And and the enzyme here is the ferrochelatase. So now let's read. Okay, so lead poisoning. What is the affected enzyme? We have the ferrochelatase and ALA dehydratase. So let's look at the picture. Let me change the color. So in lead poisoning, we are inhibiting the ferrochelatase, this step, and also the other step which there said is this. Lead poisoning, ALA dehydratase. So if you were to inhibit both of these steps, you are going to accumulate some things. So you are going to accumulate protoporphyrin and ALA. So let's look here back. You are going to accumulate ALA and protoporphyrin just by lead poisoning. So what is the presenting symptoms of this? You have microcytic anemias. See, when you can't make heme, the end product was heme. Here, when you can't make it, you have microcytic anemia. Basophilic stippling in the peripheral smear. Look at picture A. Basophil means blue color. So blue stippling on the peripheral smear. You will also see ring sideroblast in the bone marrow. GI and kidney diseases. In children, you have exposure to the lead paint. which leads to mental deorientation. Uh, and adults, so lead paint, and I think they were specifically telling about like 1978 houses, old house, lead paint, which leads to mental deterioration. Okay, in adults you have the environmental exposure, for example, from batteries, ammunition leads to headache, memory loss, demyelination, peripheral neuropathy. So basically adults get it from environmental exposure, or second thing is the occupational exposure. And the child gets from the chipping of the lead, eating the chip paint leads to lead poisoning. Alright, moving on with acute intermittent porphyria. What is the affected enzyme here? The affected enzyme is porphobilinogen deaminase. So let's change the color here. We have the acute intermittent porphyria, and the enzyme which is not working is this porphobilinogen deaminase. So if you were to knock this out here, the accumulation, you will have all of this accumulated back. Excuse me. So you have porphobilinogen and ALA accumulation. 5Bs are the symptoms. You will have painful abdomen, port wine colored pee, very important. Port wine colored pee, polyneuropathy, psychological disturbances, and precipitated by factors that increase the ALA synthase. For example, CYP450 inducers alcohol starvation. So here, what is this port wine? Because this is sort of, they will tell you, you have a port wine. They're not going to say port wine urine, but they will say it's a reddish urine. And magically, no, I'm just exaggerating a little bit here, but it's a reddish urine. Let's go back to normal without exaggeration here. A reddish urine that darkens on exposure to light and air. Okay, so they have reddish urine that gets dark, that gets more darkened when it is exposed to light / air. So what's really happening there? So basically you have the oxidation. This thing is getting oxidized when it is exposed to light or air, leading to more darkening of the urine. Okay, that's the port wine urine. All right. So you will have peripheral neuropathy, peripheral neuropathy. You will have also precipitated by factors that increase ALA. So factors that are increasing this enzyme here, this enzyme, which is a rate limiting enzyme, which are pushing the things here, pushing the whole biochemical pathways this way, and here you have the blockade, so you have more and more accumulation. So anything that is pushing and increasing the ALA synthase, which is a rate limiting enzyme, precipitates all of this more. So what are those things that would cause it? Well, they are the CYP inducers, all the inducers. You have alcohol, and you have starvation. Okay? So you must avoid P450 inducers. and all of these they'll call land starvation, so that you don't precipitate any of this thing. Okay, and this all presents acutely. So let's talk about treatment now. Treatment is hemin and glucose. Hemin and glucose. Glucose, as we said here, starvation causes precipitation, so that's why we're giving glucose. Okay, and you could prevent. You can also prevent. This is treatment, but also prevention. What is the prevention now? Prevention is based on inhibiting the ALA synthase. So you inhibit the ALA synthase, and you don't let it go towards the deficient enzyme. So you're inhibiting it here. You're inhibiting it here at ALA synthase, so it doesn't even go towards that area. So that's the prevention. So you inhibit the ALA synthase. That would lead to decreased formation of profibrinogens, right? So that's kind of a prevention. You're trying to prevent those symptoms to come. So that's what we have for acute intermittent porphyria. Let's talk about Porphyria, Cutanea, Tarda. Let me erase some of this so it makes less junk here. Let's just change color. So here in Porphyria, Cutanea, Tarda, now we have the deficiency of uroporphyrinogen decarboxylase. Uroporphyrinogen decarboxylase, Porphyria, Cutanea, Tarda. So nothing is moving from here onwards. So what is going to accumulate? This guy is going to accumulate uroporphyrin, which is a tea colored, causes tea color. Here you had a red color urine, port wine reddish color. Here you have tea colored urine, just because different products. Here you just have uroporphyrin, which is a tea colored urine. And what other symptoms you're going to have? Blistering, cutaneous photosensitivity, very important. Cutaneous, look at the picture. They even showed you the cutaneous photosensitivity. And the very nice question they will be saying, hey, listen, the guy goes out and he has only sun exposed areas are the hands or the neck, and that exposed area is now forming blisters or some change in skin, normal skin. Just trying to confuse you with is it the cancer of skin, because you have been exposing yourself to a lot of UV rays. So it's really important here. Very importantly, they will say this thing, although they're mentioning cutaneous photosensitivity. So he went and sun exposed area become darkened. Now we can see big, and they will mention it from this to 2 centimeters. Hyperpigmented areas. What is it? Just to confuse up things, but to remember, we have hyperpigmentation, cutaneous photosensitivity on sun exposed, photosensitivity, same thing. What this means is exposed area. You have sensitivity against the on sun exposed areas. That photosensitivity can cause blistering or can also cause hyperpigmentation. Okay, most common this is most common porphyria. And one more thing, just from the name, Porphyria, Cutanea, Tarda, tea colored. Tarda, tea colored urine. Just from the name, Porphyria, cutaneous blistering or hyperpigmentation. Now, again, same thing, exacerbated by alcohol consumption. Again, this guy was also doing with alcohol consumption. Causes could be familial or through the Hep C. Treatment. You have the phlebotomy. You can do sun avoidance or anti-malarials, hydroxychloroquine. Okay, so that's pretty much it for the Cutanea cutarda, Porphyria cutanea tarda. So all you have to know is basically, if you know somehow this thing, and the enzymes are really important and the byproducts are really important. So because that's how you can tell which enzyme is deficient, what is going to be the what is going to back up, and what will we have the accumulation of, and then you can look at these signs symptoms. But that's pretty much it for the heme synthesis in porphyrias and lead poisoning.